Your only job is to relax. Just let me take care of everything, okay? Good. Just write a couple another one just like that. So a deep breath in and out. Perfect. I'm just going to move the stethoscope to a few different spots now. Just listening carefully. Okay. Everything sounds perfectly clear and open. Now, if you can, I'm going to listen to your back. I'll just place this here. Take a deep breath for me. And release. Good. And again. Inhale. And release. Your lungs sound so clear and healthy. It's the sound of pure relaxation. Okay, just one more deep breath in and out. Beautiful. Okay, everything sounds exactly as it should. You're doing so well. Okay, now I'm going to put on some gloves. They're very soft, and some people find the sound itself to be quite relaxing. Alright, so I'm going to start by just gently examining your head and your scalp. Okay. So I'm just feeling for any signs of tension. I just want you to relax your neck and let your head feel heavy in my hands. I'm just using my fingertips to apply the gentlest pressure here. Just checking the scalp. Everything feels wonderful. Any tenderness? No. That's good. Now I'm just gently feeling the muscles right at the base of your skull. So many of us hold tension here without even realizing it. So just let that clear, no redness, no inflammation, and your tonsils look perfectly happy and healthy. Your teeth and gums also look great. Okay, you can relax. All done. Great. Okay, so everything looks absolutely pristine. Just a couple of final little tests for your motor function and reflexes. Okay, so can you hold out your arms straight in front of you for me like this? Good. Okay, so I want you to push against my hands. Alright? Push, push, push. Excellent strength. Okay, so now you're going to pull towards you. So pull, pull, pull. Perfect. Now, can you squeeze my fingers? Squeeze them as hard as you can. Good. Very strong grip. Okay, and the other hand. Squeeze, squeeze, squeeze. Excellent. Okay, you can relax your arms now. So finally, let's test your reflexes. I have my little hammer right here. It has a soft rubber tip. I'm just going to gently tap right below your kneecap. So just let your leg completely be loose and relaxed like a heavy pendulum. Good reflex. And the other side. Great. Do that one more time. Just let it hang heavy for me. Okay. Perfect. Just one more on your elbows. So just let your arm go all floppy. Okay. Excellent. And the other side. Perfectly done. Your reflexes are very responsive. Your nerves and reflexes are all in perfect working order. Well, that concludes our examination for today. I'm just going to take these gloves vision.